Welcome to our channel, where we strive to provide you with valuable information and insights to empower you on your health journey. In today's video, we'll be delving into a critical topic that affects many men worldwide: prostate cancer and its treatment options. Prostate cancer is a complex condition, and understanding its various stages and available treatments is vital for making informed decisions about your health. We'll take you through each stage, explore the treatment possibilities, and shed light on potential side effects, allowing you to navigate this journey with confidence. About 1 in 8 males in the United States will receive a prostate cancer diagnosis in their lifetime. Numerous therapies have been developed for this condition, but the optimal approach for you will depend on your cancer stage, its aggressiveness, and other variables such as age. Prostate cancer is highly manageable, boasting an almost 97% 5-year relative survival rate. Nevertheless, before commencing treatment, it's crucial to consult a physician or healthcare expert to discuss your available options. Certain treatments may be more aggressive than others, and most will entail side effects. Let's delve into your treatment alternatives and explore how you can effectively assess the advantages and disadvantages of each option. What elements impact the choices available for prostate cancer treatment? Numerous therapies have been developed for prostate cancer, each carrying its own set of advantages and risks. Rarely is there just one definitive option. Several factors can influence a doctor's recommendations for treatment, including the stage of your prostate cancer, your age, the predicted rate of cancer growth, the presence of other health issues, such as diabetes or heart disease, previous surgery for an enlarged prostate, the healthcare resources available in your region, personal preferences of you and your loved ones, potential side effects and complications from treatment. The cancer stage holds significant importance in guiding the course of treatment. The widely used staging system is the American Joint Committee on Cancer, AJCC, tumor node metastasis, TNM, system, which categorizes cancer into stages 1 to 4 based on the following criteria. Tumor, assessing the size of the cancer. Node, determining whether the cancer has spread to nearby lymph nodes. Metastasis, identifying whether the cancer has spread to distant parts of the body. Additionally, prostate-specific antigen, PSA, levels play a crucial role in the diagnosis, as elevated levels can indicate the presence of cancer or other prostate-related conditions like prostatitis or a urinary tract infection. Your grade group, based on the Gleason score, helps evaluate the likelihood of rapid cancer growth or spreading. Overall, these factors collaboratively shape the course of prostate cancer treatment and decision-making processes. As the cancer stage plays the most significant role in determining the course of your treatment, we have categorized the remaining sections of this video according to the stage of your cancer. Phase 1, Phase 2, Phase 3, Phase 4. Phase 1 treatment choices. Phase 1 prostate cancer represents the earliest stage of the disease. At this point, the cancer is small and confined within the prostate. During this phase, PSA and grade group levels remain low. Over 99% of individuals diagnosed with prostate cancer in this stage experience a survival rate of at least 5 years, indicating a favorable prognosis. It's important to note that while other causes may still pose a risk, the likelihood of succumbing to prostate cancer complications is less than 1%. Treatment options for Phase 1 prostate cancer typically involve a combination of active surveillance, surgery, or radiation therapy. Additionally, you may have the opportunity to participate in clinical trials exploring innovative treatment approaches. Active monitoring and vigilant observation. Active monitoring entails refraining from administering treatment and instead conducting regular tests to track the cancer's progression over time. Doctors commonly advise active monitoring if the cancer is not likely to spread to distant organs beyond the prostate. This approach typically involves regular PSA screenings and doctor consultations. Additionally, periodic prostate biopsies, tissue samples, may be conducted every few years to check for the presence of cancerous cells. Watchful waiting may also be recommended, particularly for older individuals or those with significant underlying health conditions. During this period, treatment and routine tests are withheld, but measures to alleviate symptoms and enhance the quality of life may be provided. Surgical intervention. A medical professional might suggest a radical prostatectomy, a type of surgery aiming to remove both the prostate and seminal vesicles. Typically, this procedure is coupled with a pelvic lymphadenectomy to eliminate lymph nodes and assess for cancer presence. Following surgery, you may also undergo radiation therapy. Radiation treatment. Radiation therapy employs high-energy rays to destroy cancer cells. It can be combined with androgen deprivation therapy, ADT, a hormone treatment that reduces the levels of androgens, hormones that can fuel cancer. Two forms of radiation therapy may be recommended. External radiation therapy. A machine outside the body directs a beam of high-energy rays to target the cancerous area. This is the most common type of radiation therapy. Internal radiation therapy. Small radioactive materials are implanted into the prostate. Research studies. You might be eligible to participate in research studies that explore newer treatment methods. Should researchers determine these techniques to be more effective than the current standard treatments, they may become the new norm. A healthcare professional can assist you in locating research studies in your vicinity that you may qualify for. You can also conduct searches on clinicaltrials.gov. Treatments in clinical trials may encompass cryosurgery, employing an extremely cold liquid to freeze and eliminate cancerous tissue. Photodynamic therapy, utilizing drugs activated by light exposure to destroy cancer cells. High-intensity focused ultrasound therapy, using high-energy sound waves to generate heat and destroy cancer cells. Remember that clinical trials are experimental and may not necessarily surpass established treatments in effectiveness. Consult with a medical expert to gain realistic expectations about entering a clinical trial for prostate cancer. They will also ensure that the trial does not interfere with treatments for any other health conditions you may have. Phase 2 treatment choices. Phase 2 prostate cancer remains confined within the prostate gland, but PSA and grade group levels are higher. During this stage, a doctor may be able to detect the tumor during a digital rectal exam. Over 99% of individuals in this stage are expected to survive prostate cancer effects for a minimum of 5 years, not considering any other potential causes of death. The AJCC staging system divides stage 2 into 2A, 2B, and 2C based on tumor size and cellular appearance under a microscope. These distinctions are taken into account by a doctor while identifying the most suitable prostate cancer treatment options for you. Treatment for phase 2 prostate cancer is similar to phase 1 and may involve a combination of the following options. Active monitoring. Regular monitoring of PSA levels and occasional tissue sampling to detect cancerous cells. Watchful waiting. Focusing on symptom relief and maintaining the quality of life, especially for older individuals or those with other health concerns. Radiation therapy. A treatment aimed at eradicating cancerous cells. Radical prostatectomy surgery. Potentially coupled with radiation, this procedure removes the prostate and surrounding tissues. Clinical trials, investigating newer treatment approaches. Active monitoring is typically recommended for stages 2A and 2B. Phase 3 treatment choices. Individuals with phase 3 prostate cancer still maintain a survival rate of over 99% for at least 5 years, excluding other potential causes of death. Phase 3 is categorized into 3A, 3B, and 3C stages. Cancer in phase 3B or 3C may have extended beyond the prostate to nearby tissues, such as the seminal vesicles, glands responsible for producing semen during ejaculation, or lymph nodes that facilitate lymph fluid circulation throughout the body. Prostate cancer in these stages presents a greater challenge for effective treatment. Conventional therapies for phase 3 prostate cancer encompass external radiation therapy, employed to eradicate cancerous cells. ADT aids in reducing androgen levels, such as testosterone, which can slow the growth of cancerous tumors. Radical prostatectomy surgery involves the removal of the prostate and surrounding tissues. Active monitoring involves regular PSA level monitoring and examination of tumor tissues for cancerous cells. Watchful waiting, designed to address symptoms for older individuals with a high risk of side effects from other treatments. Treatment may entail a surgical procedure known as transurethral resection of the prostate, TURP, where part of the prostate is cut away. This procedure helps manage symptoms like frequent urination or sudden urges to urinate, resulting from the prostate exerting pressure on the urethra. A healthcare professional might also recommend internal radiation or participation in clinical trials. However, it is essential to remember that clinical trials are experimental and may not always surpass the effectiveness of other established treatments. Consult with a doctor regarding the potential side effects that may arise from these treatments, including incontinence, loss of bladder control, diarrhea, tender breast tissue, growth of breast tissue, gynecomastia, sudden hot flashes, reduced desire for sexual activity, difficulty achieving or maintaining an erection, increased risk of fractures or bone loss, occurrence of seizures after treatment, despite never experiencing them before. Phase 4 treatment choices. Phase 4 prostate cancer represents the most advanced stage, leading to a lower survival rate. It is categorized into 4A and 4B stages. Phase 4A cancer. In this stage, the cancer has spread to nearby lymph nodes and potentially to adjacent tissues like the rectum, bladder, or pelvic wall. Phase 4B cancer. In this stage, the cancer has disseminated to distant areas of the body, such as the bones or distant lymph nodes. The 5-year relative survival rate declines to 31% if the prostate cancer reaches these distant body parts. Certain treatments for individuals with stage 4A cancer, who are healthy enough to receive treatment, may include external beam radiation treatment with ADT. This treatment aims to eliminate cancerous cells and halt the effects of androgens, such as testosterone, which can accelerate tumor growth. Abiraterone. This helps reduce the levels of androgens in the body that can promote tumor growth. Radical prostatectomy with pelvic lymph node dissection. This surgical procedure involves removing the prostate, the affected surrounding tissue, and the cancerous tissue in nearby lymph nodes. For individuals without symptoms or serious health issues, a doctor may recommend watchful waiting, focusing on alleviating symptoms and maintaining the quality of life if other treatments pose significant risks. Active monitoring, regular monitoring of PSA levels and examination of prostate tissue for cancerous cells. Hormone therapy aims to lower androgen levels and decelerate tumor growth. The majority of stage 4B cancers cannot be completely eradicated. However, treatment can effectively manage your cancer and enhance your quality of life. Treatment options may include ADT. This can be administered alone or combined with abiraterone to lower androgen levels and decelerate tumor growth. Apalutamide, used alongside other ADT options to improve your prognosis. Chemotherapy, commonly with docetaxel, to eliminate cancerous cells. Enzalutamide to slow tumor growth. External beam radiation therapy, utilizing X-rays or proton beams to break down cancerous tissue. TURP, a surgical procedure aimed at addressing symptoms like urinary obstruction. External radiation, employed to kill cancerous cells. Watchful waiting, designed to alleviate symptoms when other treatments pose significant risks. Active monitoring, regular monitoring of PSA levels and examination of prostate tissue for cancerous cells. Bisphosphonate therapy, treatment for bone pain. Alpha emitter radiation therapy, utilized for treating prostate cancer that has spread to the bones. Radical prostatectomy with testicle removal, also known as an orchiectomy, this treatment option is considered. Numerous of these therapies can decelerate the advancement of tumor growth and extend your lifespan. However, it's important to bear in mind that these treatments may also lead to distressing or disruptive side effects, which can negatively impact your quality of life, including incontinence, loss of bladder control, bloating, feelings of depression, reduced desire for sexual activity, difficulties in achieving or maintaining an erection, rapid weight gain or loss without any changes in diet or lifestyle, abnormal heart rate, either too fast or too slow, persistent fatigue, tightness in the chest, breathing difficulties, nausea or vomiting. Consult with a doctor to determine whether the potential benefits of treatment outweigh the risks of side effects or complications. For some individuals, active monitoring and watchful waiting may be the most suitable approaches to alleviate pain and discomfort caused by the spread of cancer cells, particularly when other treatments may prove ineffective or too risky to attempt, especially if they are older or have other significant health conditions. In conclusion, understanding the various stages and treatment options for prostate cancer is crucial in making informed decisions about your health. While some treatments can effectively slow tumor growth and improve longevity, it's essential to be aware of potential side effects that may impact your quality of life. Remember to consult with your doctor to weigh the benefits and risks of each treatment option based on your individual condition. For some, active surveillance and watchful waiting may be viable alternatives to manage pain and discomfort associated with cancer spread. Stay informed, stay proactive, and prioritize your well-being. Thank you for watching, and don't forget to hit the like button and subscribe to our channel for more informative content. Wishing you good health and hoping to see you next time.